Vanakkam. Our channel GK Hand Surgery is devoted to teaching hand surgery, plastic surgery, trauma surgery and ethics. This is done through clinical case discussions, surgical technique videos, quiz sessions and most importantly video lecture series which have been the most popular. After our successful teaching video series on adult brachial plexus injuries which was dealt with in 13 sessions, flexor tendon surgery in 15 sessions, extensor tendon surgery in 12 sessions, fractures and dislocations in the hand, a series which consisted of 23 sessions, nerve repair and reconstruction 29 sessions and local flaps and reconstruction 18 sessions. It is now time to move on. Introducing our next video lecture series on a topic that deals with a condition that is seen quite commonly, unfortunately, but needs to be understood well before treatment can be instituted. The B2P2, birth brachial plexus palsy, otherwise known as neonatal brachial plexus injury or obstetrical brachial plexus injury. This topic will be dealt with in a series of videos dealing with introduction and etiology, clinical evaluation of birth brachial plexus palsy, relevant investigations that need to be done and interpreting the results of the investigations, decision making, nerve surgery, neurolysis, grafting and transfer, the basic principles, surgical techniques, exposure of the brachial plexus, the surgical technique of nerve grafting, contralateral C7 transfer, surgical techniques of distal nerve transfers, an overview of secondary problems in birth brachial plexus palsy, secondary problems involving the shoulder, the presentation and the treatment, and secondary problems involving the elbow, wrist and hand, the clinical presentation, the problems and the treatment. Coming soon on GK Hand Surgery YouTube channel. Subscribe to stay connected with the latest in learning hand surgery, plastic surgery, trauma surgery and ethics.